some of you will know me as Alan and others will know me as Crockett. For many years now, I have been an advocate for closer ties with mainland Australia. I've seen successive Norfolk Island governments steer us further and further away from the Commonwealth in the misguided belief that we'll do it on our own. I believe now that the time is right to move towards closer ties, to give Norfolk the essential change that it needs to put it on a path to a long-term sustainable future. We need essential change on many fronts, and this is reflected in the scope of the policies that have been developed by Norfolk Labor. My focus today, however, will be on our health and aged care policy. Norfolk Labor knows that there are cases of financial disadvantage which prevents people from accessing health and medical services. Norfolk Island Healthcare Scheme operates to the detriment of low-income earners who cannot afford the upfront fees and the excess of $2,500 and who are then forced to deny themselves and their family proper health care. Financial constraints have another impact on healthcare in other ways as well. Over the years there have been numerous reductions in the range of healthcare benefits available, and now there is anecdotal evidence that offshore medical referrals are influenced more by the health of the scheme than by the health of the patient. There are also some evidence to suggest that having permanent geriatric patients residing in the hospital is considered desirable by our government, as it helps with the cash flow for the hospital. This goes against all research that shows that better health outcomes are gained when the elderly are able to stay in their own homes for as long as possible. Facilities for the elderly are inadequate now, and with the ageing population they will become even more inadequate. Norfolk Labor aims to ensure that health and medical services are more affordable and therefore more accessible, and to upgrade health facilities to the standards that are sufficient to meet the demands into the medium and long-term future. To do this, Norfolk Labor will seek the extension of the Commonwealth Medicare scheme to Norfolk Island. This can be done on a phased-in basis if necessary, with early benefits going to low-income earners. As an interim measure, we would review the existing healthcare scheme to make it more equitable and affordable and remove those features which disadvantage low-income earners. We will also seek the extension of the Commonwealth Pharmaceutical Benefits Scheme, and again, in the interim, devise means of subsidising the cost of medicines for those on low incomes. Norfolk Labor will seek the extension of the Commonwealth Aged Care Act and investigate and implement a range of services that will enable the elderly to remain in their homes for as long as possible. We need Assembly members who will enter into serious and cooperative negotiations with the Commonwealth Government for better long-term health and aged care outcomes. Norfolk Labor team offers hope that this will happen. To do this, we need all four like-minded Labor candidates to be elected. We'll no longer do it on our own.